along here. So first and foremost, skin cancer is the first thing we're going to talk about today. So predisposed skin cancer is what they call sunspots. Those sunspots that are big freckles are predisposed skin cancers. So when you're assessing patients, keeping an eye on those for sure. American Dermatological Association says that sunblock should be at least 45 SPF, at least 45 to prevent any kind of skin cancers as a whole. Basal cell carcinoma frequent exams are needed, and keeping that treatment, best thing is frequent exams. The squamous cell carcinoma is your second leading cause of skin cancers, where we know our biggest is malignant melanoma. It's the deadliest. One thing that they say about melanoma is no sun exposure at all. Fully protected head to toe when going out in the sun. Clinical manifestations of the melanoma is changes in skin over a period of time. You watch a specific spot and then it doubles in size within 10 days, so it's very quick. So seeing something that's there and then it looks different, and they roughly say around 10 days. To decrease the chances of melanoma is fish oil capsules. Here's just some visual of two different types of melanoma. One almost pretty symmetrical for the most part. It's usually a spot that changes colors, goes to different colors, and then again doubles in size. Assessment 1 is a mole, becomes itchy, ulceration, and then lymph nodes become palpable. There's also the second is what we know as A, B, C, D. So A meaning symmetrical, asymmetrical. B is border notching, so they're border notching. The C is the color change. 4 common colors with melanoma are red, black, brown, and white. Red, black, brown, and white. And the diameter is usually 6 millimeters or greater. So A, asymmetrical, border notching, color, and diameter. Frequently asked is they get pruritus or itching. That spot itches and itches and itches and itches and itches. And then with the scratching causes that ulceration. Diagnoses listed there for you: complication, metastasis, and then infection to the cervical site. Because sometimes they might have to dig deep because of that border notching. So we have to keep, of course, clean, dry, and intact for that dressing change. Pain control, emotional support because it is the deadliest. And then we have Kaposi sarcoma, specific to who? HIV and AIDS. It's the red raised lesions, usually seen, it can be anywhere, but it's usually more predominant in the torso, especially on the posterior side. That is common for those types of patients. Questions about any of that?